Okay, so to finish off our IV push, also I would want to make sure and watch them for any reaction that they would have, and then document at the end as far as the route medication, the amount, the time, where I gave it, and again coming back afterwards to check and make sure that the pain tolerance, that their pain level has gone down, and then if there's any reaction as well. And with that, I'm just noting the site again, making sure it's not red, tender, or swollen when I administer that. So to do our DCIV, again, I'm going to verify the orders, make sure that this is the correct patient, and that our MAR says to do so. I'm going to wash my hands, introduce myself, tell them the procedure, what we're going to be doing, which is going to be removing that. So I'm going to wash my hands. I'm going to put on gloves. Can you state your name, your date of birth? Verify. So I'm going to go ahead and remove your IV port here. And with that, I'm going to remove the tape first. And again, if it's super sticky and I'm not able to remove it without pain, I would apply alcohol and help it remove. Again, supporting the catheter here to stabilize it for the most comfort of the pain, or for the most comfort of the patient. No pain for the patient. All right. And before I get all that carried away, I'm going to get my gauze ready here so that I have that to grab once we get this out. All right. As I do this, again, I'm observing, making sure the redness, any swollen, anything that's alarming. Okay. And then I'm going to just apply pressure as I take it out, slight pressure, and then once I take it out, I'm going to examine this to make sure that there's no missing pieces, that it's all intact. Again, noting the chart to make sure that it's the right size that they said that they put in. Discarding that, not in the trash. I would discard it in the biohazard. But applying pressure for approximately 2 to 3 minutes. And then you would apply a sterile dressing, which this we're going to pretend is our sterile dressing, which I have right here. But you do lift up the gauze and look at it to make sure that it is, everything looks good, briefly. Then you would tell the patient just to watch it if there's any additional excessive bleeding. And I would document what time I took it out, what it looked like, the coloration, and things like that. And that is that. Yay!